You gave us a really interesting nugget there at the end about that combo between the veterans and DoD. You want to give us another example of some interesting work that you all are working on as you're on this electronic health record journey?
Yeah, I think I think as we talk about the electronic health record, I thought maybe I would pivot a little bit to talking about another set of digital technologies that are really important in how we think about care delivery to veterans. What we heard earlier in the program was about the trend and the importance of bringing healthcare to the patient, in our case, the veteran, where they are. I think we as the healthcare industry learned an awful lot during the COVID pandemic about that shift. But we're not talking about that as much lately, although I think it's just as important that we're thinking about how we are getting care to where people are. This year, in fact, just last month, May of 2024, was the 21st anniversary of there being a formal telehealth program in VA Telehealth Services.
Impressive.
21 years is a pretty significant run. And just to give you a sense of the scale, last year, more than 2.4 million veterans took part in more than 11.6 million episodes of care through telehealth. And more than 9.4 million of those telehealth visits were video telehealth visits to a veteran on their mobile device or in their home or in a location of their choosing, which is really, I think, pretty significant. But taking that another step forward, it's much more than that. It's how we're using telehealth to deliver asynchronous care, capturing images, for example, in the home and embedding that into clinicians' workflows so that we can actually provide better care. Last year, more than 290,000 veterans had more than 314,000 visits, whether it be teledermatology, teleretinal screening, where there was an asynchronous exchange of information. And on top of that, really delivering tools that help our patients engage in their own healthcare on their own terms. We're super excited about our VA Health and Benefits mobile application. You can find it on the iOS App Store, the Google Play Store as well. We have had more than 2 million downloads of our flagship mobile application. And this is a place where veterans can go for a one-stop shop to check status of their claims, to get prescription refills, to find out when their appointments are, to message their clinicians or their VA healthcare team, really bringing that whole experience together for veterans, in the phone that's in their pocket, is a part of where I get excited about what we're able to achieve with health IT modernization.